This conference will now be recorded.
First of all, wallahi, 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 wallahi. How many times? 5, yeah? You must have an angry patient in the exam. Done? I'm going to show you how to deal with an angry patient. Don't memorize it, understand it. Okay? Okay. You are an FY2 doctor in the medicine department. Ashwarya Roy is the mother of 3 years old. Is the mother of what? 3 years old Ahmad Roy. We don't know how Ahmad and Ashwarya Roy together, but okay. Ahmad Roy, yeah? Yes, okay? She brought him to the hospital yesterday because of a chest infection. Chest infection. He was given amoxicillin even though, sorry, he was about to be given amoxicillin even though the mother told the doctor treating him that Adam or Ahmad is allergic to amoxicillin. She's very angry, or she's upset, or talk to her, address her concerns, whatever. Okay? Is the question clear? Okay. I am Ashwarya Roy, and you are the FY2 doctor. And Dr. Amar, when you're ready, tell me you are ready. So Dr. Amar Sobhy can start the bell. Okay?
What is the child is?
The child Ahmad Roy. I know they don't come together, but age 3 years old.
Have to say ready?
You ready?
Yeah, I'm ready.
I'm gonna
start when you say hello.
Dr. Amar Sobhy في الدنيا. The best ever Dr. Amar in the world. Start the bell.
Okay, time start now.
Okay, start. Guys, can you see me? Can you see him? Yes? Let's start.
Okay. Hello. Hello, my name is Dr. Siddharth, one of the doctor here in this medicine department. Ashwarya. Ashwarya, how can I help you today? Ashwarya. From my notes, I can see that you are here for Ahmad. Can you please tell me what's going on with him and everything? Sure, I can see there's something that's bothering you.
Go and get me your fucking senior. I don't want to talk to you. I want someone who's senior.
Definitely.
I'm not happy with the service that you are given in this hospital.
Definitely will help you with that. I'll fix an appointment with my senior. How about we can have a chat so that I can get to know what exactly is going on and how can I help you with that?
Well, I know that a junior doctor is not going to be able to deal with that. I've been working as a nurse before, and I know that this is beyond your limit. Okay? This hospital is careless. You guys don't care about us. You guys don't care about patients. You don't even listen to patients. Have you been taught about active listening or not? I have seen your colleague yesterday, and I've told him that Ahmad is allergic to amoxicillin. Ahmad is allergic to amoxicillin. I told him few times. And when I took my son home, I realized that he's being given a medication that he's allergic to. That was yesterday. I brought him because he had a chest infection. What's happening to you guys? And all of a sudden, I noticed that he's allergic to that medication. And it was midnight. I couldn't bring him back to the hospital.
We'll definitely help with that, Ashwarya. What you are worried about, definitely it's a very valid concern.
How come it's a valid concern? How come? If he was your son, would you accept it? What if I'm illiterate? What if I cannot read or write? What if I didn't know that it's amoxicillin? What if I didn't know?
Yeah, sure. You
Pen
are.
and paper.
Yes, sure. You are correct. And sometimes so these kind of things are not really acceptable. But can I have a small bit of chat so that we can get in a better position how your son is doing?
What do you want to ask about? What do you want to ask about?
How is he doing now?
He's got a chest infection. That's what he has now. He's got a chest infection. And you're going to give him anaphylaxis on top of it. That's how he's doing now. If I would have given him the medication, it would have gone. Because it will be chest infection and anaphylaxis. You guys are careless.
The best part is that you haven't given him, and it's really reassuring. But will that be all right if I ask you, like, how did he get, like, what symptoms did he get so that you had to come to the hospital overall?
Fever, coughing, you know, discharge from his nose. He was not breathing well. Yes, but what is that to do with what we're talking about now?
Definitely, that's we will be doing all our best to help you in every possible way.
Listen, I don't care about this bullshit. You guys bullshitting me.
Yes.
Definitely we're gonna do our best. Definitely we're gonna do this. Definitely we're gonna do that. I don't give a fuck. I don't care. I just wanna know, why did you do that? I just don't know what's gonna happen to my son now. Why would you give him a medication if I have told you that he has allergy too? Why would you do that?
How can we chat with the doctor who have given him, and then after that we can come to you?
Yes, we can. We can chat with him. Where is he?
Yeah, we will have a look on that, and then after that we can come to you. But before that, how about it? Like, as a mom, I do feel that it's a very valid concern. But how about, like, we can sit together, and then after that we can have a chat and get to know the base of the problem.
Listen, I wanna know now. Tell me what's gonna happen, and tell me why this happened. And I'm just not happy. You can tell me now what's gonna happen now.
Yeah, since you are the nurse, you already know that amoxicillin is in his condition. He is allergic to amoxicillin. It's wonderful that you didn't give him, and that's really appreciable. And what we will do is, like, if what you are thinking it's the same, and if he has been given instruction about that, if you have already told him, and if he has already got to know, we can talk to my senior. Like, as you want, we will talk to our senior. I can also fix an appointment with my senior, and then you can have a chat with him.
Okay, all right.
And then after that, we can get to know the base of the problem.
Okay, all right. Fair enough. Okay.
Yeah.
Okay, fair enough.
Does it sound good to you?
Okay, fair enough.
How about we see?
You can set an appointment with your consultant and we'll see. Yeah, fair enough.
How about we sit and then have a
Okay,
chat?
all right. Okay. Okay.
Sure, yeah.
Yes.
So, does Ahmed, does he have any medical conditions?
No.
Any medications that he is under at this present time?
No.
Any allergies by any chance beside the penicillin?
No.
And what does happen when he gets the amoxicillin overall?
He gets rash all over his body and he started having shortness of breath and just anaphylaxis.
When was the last time you got to know? How did
a year ago?
A year ago. How
Yes.
did you get to know about it?
Well, because another stupid doctor has given him this medication without doing like tests if he's got allergy or not, and then he started developing these symptoms.
Okay.
2 minutes remaining.
So, beside having an appointment with our seniors, and we will be talking to my colleague, do you have any other concern that you want to address?
What's going to happen to my son now?
How about we will definitely look at him. Beside the amoxicillin, we can change the diet, the medicine, and we'll change it to another medications which will suit him for the chest infection.
Okay, would you gonna give him anything? Will you give him antihistamine or anything?
Since you told me that you haven't given him the medications, and he doesn't have any symptoms at this present which we need to give him antihistamine, we will just change the medication to fix that. How does it sound to you?
Okay, all right. Okay.
We'll be giving another antibiotics which suits him.
Okay.
I'm consulting my senior to get to know the base of the medications.
Okay.
I'll be consulting my senior, and then after that, the medications which is appropriate to him, we'll definitely give him, and then after that, we'll follow up with him, how the things are going on, how the infection is getting better or not, and everything.
Okay. All right.
How do you feel about it, Ashwarya? Okay, all right. Any further concern if you have? Anything you'd like to add on this?
I just want to complain. I want to complain about these doctors.
You have all the rights to complain about him. I will help you with that. We have a service called PALS. It's like Patient Advisory Liaison Service, where you can complain about it if you are not happy with the problem, if you are not happy with the situations what has happened. And meanwhile, we have also the incidents form. Do you have any idea about it?
No,
Since you
no,
are
what
also
is the
the
incident form?
Yeah, so it's an incidents form where we fill the form and
File
then
is up.
write it like what's the problem in that, how did we get to know, how did the problem happen,
Okay.
so that we can have a chat without
Time is finished.
Yeah.
Perfect. Well done. Thank you very much. Thank you. Okay. Angry patient. He was very cool. He was very calm. Angry patient. Any patient or angry relative. Can I just have this slide? Nothing is in the back. Yeah, I'm just gonna take this. Yeah, yeah. Nothing in the back. Okay. No, I make sure so he doesn't lose anything. Okay. Angry patient. How would you deal with a patient or a relative who's angry? Okay. I'm gonna speak honestly with you. How many of you thought that he will be given antihistamine and he will? Did anybody think of it? Because the question that people are used to usually that the child developed rash, but I changed it that it was about to be given. Clear. So there is a station in the script that a child has allergy and he was given medication, okay, and he developed what? Rash. But this station is he was about to. He was about to. 1 second. So make sure that you don't go there and say I will give him antihistamine, and no, that was about. So he was not given, okay? But he should have made sure and said, so you did not give him the medication to make it clear, as I am sure now I have spoken to it, so to make sure. Okay. So in an angry relative station, how many people do we have? 2. We have 2 people. Make sure you are sure that you have 2 people. The 2 people are the mother and the child. So you must calm her down. You must make sure she is sorted, her concerns are addressed, and you must make sure the child is sorted as well at the same time. So 2 people. Which one you will deal with first? The mother or the child? No, the mother. Because unless you deal with her anger, you won't move to the child. And once you deal with her anger, you must move to the child. So you need to make sure you have a map in your head. Okay. How many stations do we have in PLAB to angry relatives? Plenty. A daughter who's angry because her mom is not given a medication. Okay? 1 second.
Dr. Mo, I'm really sorry for interruption, but there's a lot of people who want to join, but they find the meeting full and they are asking for another link.
Okay. Guys, does anyone have Zoom? Zoom on his phone? Yeah. Can anybody just, I'm sorry, so your colleagues are, can you open a Zoom as you are the host, yeah? And we send the link to, over, and then they can,
Another link.
Yeah, then they can attend through Zoom. If you don't mind. So this is like, yeah, anybody who has Zoom. Well, then we can put it on a charger here. Don't worry. Do you have a charger? Do you have a link? Yeah. I mean, can you get a link of the Zoom? I'm sorry, guys, online doctors, just to give us like 1 minute, yeah?
Sure, Dr. Mo.
I'm sorry, just to want to make sure the other guys, they can join. I'm sorry. If you were in the same situation, I'm sure you'll understand. Sorry. Does anybody understand who has Zoom? So we move forward quickly, Zoom, and then get the links. You make Zoom, yeah. Get the link, send the link, and then we.
Remo,
Yes.
sometimes the Zoom cuts off the streaming after 40 minutes if they are not.
Well, I'm gonna send it back again. I'm gonna resend it, but just it's the quickest way now because go to meeting 250 doctors full, huh? Send it to me, Dr. Am. Send it to the academy number. The doctor will send you Zoom link, and can you share it, please? December, October 2 batches, July, August, May, April, February, January, December, please. Yeah.
So I'm sending the link.
I sent the link. He sent all. He sent all.
Okay, so I'm like.
You sent it to Dr. Am? Yeah, you just need to see how we can have this phone stopped, whatever. Yes, give me this phone here, please, on the side, and we can just like. So, لا ما خلي الكاميرا الأمامية أفضل. Do you have to admit them, or they will join right away? Oh, we have to admit.
No, I can make it while I'm sitting.
Okay, perfect. والله يعني make the camera, yeah, that way, and admit them.
Oh, a lot.
Online doctors, can you hear me?
Yes, doctor.
Yes, Dr. Mo.
Yes.
Yes, we can.
Yes, we can.
واحد هيدعي لك يعني someone will do والله say he والله. Guys, please do دعاء to the doctor who's doing the Zoom meeting because he's admitting one by one, and do دعاء for him, so you know خلاص. Is there no option admit all?
Yeah, can you make it public?
He sound like me in the technology. Exactly.
I have advanced technology. Yes.
Huh?
I'm advanced.
Advanced, but I think there's an option that.
Today I'm fine. Yes. Meeting set.
Can you mute this guy who's just like, there's an option mute.
Turn your volume down.
They didn't find how to approve anyone automatically to the Zoom meeting. They can go for the security.
Okay. Is there an option or not?
Yes. You will find 3 dots, and under that there is a word called more.
Yeah.
You can press on it.
Any luck? How many are in the Zoom meeting now?
65.
Huh?
65.
Fair enough. Let's start. Don't admit that. Let's start. Just let's start. Let's start, guys. Let's start. So, an angry patient. That's it. I mean, fair enough. I mean, there's not much that we can do.
I think we can skip this angry patient. Don't you think so? Angry patient, medical error. No, because you're here now. So
That's why just people.
You can turn your volume down.
Turn the volume down. I want to start.
Dr. Mo, this has been recorded, so you definitely share it, right? And if you're going to do that, then we can just move on, no?
No, I will move on now anyway. خلاص, just put it down and let's just, you know, because it's getting frustrating.
Make it close.
Yeah, that's it. That's it. It's just like,
Just ask them if they come here.
that's it. That's it. Fair enough. We have 72 here. Understand? Fair enough. I'm not just gonna admit anybody. Let's move on. Let's move on. Okay, guys. So. Okay, guys. So, an angry patient. You have two people. I said, the mother and the child. Okay. If a station in the exam, I'm giving you all the scenarios now. Yeah. A mom and her daughter. So the daughter is angry because of her mom, who's given something, was managed incorrectly. So you have the daughter, and then move to the. Please, guys, it's a habit now. If you have a father who's angry about his son, sort the father out who's angry. Sort the father out who's angry, okay, and then move on to the son. So that's the approach of an angry. There is two people. Don't forget. Okay, this is number one for you to know. Number two, I want you to give. I want to give you 8 words. How many words? 8 words where you will use them to deal with the angry person. What about the other part? What about the son, the daughter, the mother? That's your job. It is normal station. It is what? Normal station. What do you mean by that? It's my job and it is normal station. This case that we have been talking about, it is a mother who's angry because her son had a chest infection yesterday and he was about to be given amoxicillin. So the first part is the mother. We're gonna calm her down, make sure she's okay. Then we move to the son quickly. What symptoms did he have? Exclude meningitis, as we all know. And as he's not being given antibiotic, make sure that right away he will be given antibiotic, and feel free even that you can admit him because he's been since yesterday with no antibiotic. Do you understand? And you say, as I can see that you said that he was brought yesterday to the hospital and you did not. I have told him, I brought him, and I realized the middle of the night that it's amoxicillin, and I brought him today. You see the sequence, the active listening. Did you notice what I said? Did you notice the story? The story, I told him I brought him when? And I realized that the medication, but it was in the middle of the night. I didn't bring him, and I'm here now. So it's been since yesterday that he was not being given any medication. So my point is, I want you to have 2 arrows and say to yourself, in an angry patient's relative, I have 2 arrows. The relative plus the patient himself. The relative you will deal with, then you will move to the patient. The patient himself, it's either a mother who's have dementia, or a son who has fracture, neglected, or a son who's given antibiotic by mistake, which is your job. It will be a normal medicine station. Yeah? Like in this case of allergy, normal medicine. Ask about the chest infection symptoms, exclude meningitis because it's an infection, and then move on to the management. Say, I will change what? The antibiotic after doing allergy test. to make sure he doesn't have allergy to the new antibiotic will be given. Clear? And educate her. Praise her that she mentioned to the doctor a few times. Praise her. He did not praise me enough for reading and knowing and not giving. He did not praise me enough. Did you notice? I've mentioned if I read, I knew how to read. I realized he has this and I didn't give him. And I mentioned to the doctors, I should have been praised about it. Do you agree? So let's talk about the mother and the angry, how to approach an angry patient. And if they change the station, you know the rules. I will do 1, 2, 3, 4, 5, 6, 7 with the mother or the daughter or whoever is angry. Once they are sorted, I will move to the patient and I will start taking quick or detailed, quick history. Okay? I'm moving to the management right away. And when I move to the management, how many types of management? 2. So history, 2. Management, 2. What do you mean? I will manage the mother. She's angry by saying to her, any mother, any daughter, anybody who's angry, by saying if they are still angry, we can offer them complaint department and incident form and the medical part of managing the patient. Are you lost? So how many types of history? How many people? 2. Approach the angry person and then take history, because sometimes, guys, if you don't have a structure, we lose it. We get lost. And then approach the person who is sick, the person who's, the patient himself. Then when you manage, make sure you manage first the condition, and at the end, if the person is still not happy, offer them pulse and incident form. What I saw in the scripts, because I always look at the scripts, because if you are in this business, you have to know everything around you in order to do better and focus on what's missing. Yeah, I always see that people focus on the paperwork. In this kind of cases, people focus on incident form and they focus on pulse, root cause analysis meeting, and they forget that there is a person who's sick. There is a patient there. So always focus on solving the problem, making sure the person is safe, then go to the paperwork. Are you clear? So now, how to deal. So now I will talk about what now? The bullet point for angry patient. Are you lost or are you structured so far? So an angry patient. I'll give you 8 bullet points, which you will not miss an angry patient station. So the 8 words, right? Number one, distance. Write the word and I'll explain. Number 1, distance. Number 2 word, acknowledge. Number 3 word, eye level. Number 4 word, voice. Number 5 word, active listening, reflecting. Active listening and reflecting. Number 6 word, which unfortunately the doctor did not even mention it at all, apology. How many words did we write? Where did we write them? Under which part? The relative or the patient? The relative. And then you have a patient about which you will take some history, and then you will move to the management. How many parts in management? 2. The angry patient, the angry relative, sorry, and the patient himself. Yeah? Okay. So, guys, I have done few tricks to the doctor, and I've done them in order to apply the points that you have. Okay? Look at me now. I was setting me and him like a boyfriend and girlfriend, like this. You understand? I don't know, but look at the video. Look at that video. I will post it on my group later.
I thought it's because of the camera.
No. I mean, even if the camera, I said to you, I'm a simulator. Simulate with me. I sat me and him like a boyfriend and girlfriend in Egypt, where we are escaping from our family, going to a coffee shop. You understand? And to try as much as we can to get close to each other. And he did not realize. I come closer, he come closer to me. You understand? No, it's an angry patient. We are in a station. We are simulating. I don't care. I don't believe. I don't say, oh, I'll give him an excuse. He thought he. No. Angry. Anybody comes here, simulate. You understand? So I brought the chair very close, and he came even closer. And when that's guys. Now what I'm doing now, I am explaining the words I give you. What is the first word? Distance. So whenever you know the patient is angry, you get in the cubicle, angry patient, keep your distance from the start, sit, distance. Guys, these things will come with practice. Think about it. Angry person, would you come closer to him to punch you, to hit you? You understand? If you are closer, he will just, like he will point. No, angry. So, distance. What is the second word? Acknowledge. When he came in, he acknowledged I'm angry. 2 minutes later. Again, I'm not making it up. Watch the video. Just take a video. And apply everything on the video, and you will see. Now you will compare. Everybody will take the test now. Look at him. Look at him. Just look at him. He's closer. Look, Anyway, so the second word is acknowledge. He acknowledged my anger. When you look at the video, a minute later, acknowledge you from the start. I can see you are not happy. I'm here to help you. Can you please open for me? Please, from your heart. Guys, I can tell you words outside my heart, but I can tell you words, you will feel it. You understand? You will feel. I did not. It was just like robotic. No. Someone. Well, I can see you are very upset. Look at my body. What I can see you are very upset. I'm here to help you. Please open for me. I can see you're not happy. Please open for me. So please acknowledge, but don't say I can see you are angry. Angry, like acknowledge in a nice way, in a soft way. I can see you're not happy. I'm here to help you. I'm here to make sure that everything is all right. Body, the body should show. Guys, by the way, whenever I throw things in between and we start laughing, it is actually important. Show everybody that your body, your face, showing care. Not just what I can see. Look. What I can see, you are not happy. Look at that. What I can see, you are not happy. What I can see, you are not happy, and I'm here to look at my body. Look at my. It's Anyway, so acknowledge. So distance, acknowledge. What is the third word? Eye level. Eye level means that me and him should be on the same level. Imagine if somebody come sit down. Imagine if the doctor is sitting like this, okay, and the patient stood. So no, sit down. No. So what's gonna happen now? Tell me. You understand? You see that? So that's why whenever the patient stands, you stand and keep that distance. Me and them were so close. We're about to kiss. Stand up. Stand up. He was like this. Seriously. He was like this. I was like this. And when you watch the video, you will see. And we're talking. Yeah, man. Yeah. Like, no, brother. So, again, keep your distance here. So, keep your distance. Again, keep your distance. Make sure there is a distance there. So, what is the fourth word? Eye level. After that, guys, so what is the meaning of eye level? Sit. Stand. Semi-sitting. You understand? You have to be in the same level. And think about, look, it's not, I don't want to be robotic. Okay, Dr. Mo said if he stand, I stand. And then you think about it, 10 seconds, and I have students. No, guys, it comes automatic. It should come natural. Sorry? Did you pass IELTS or OET? IELTS? What did you pass English test? IELTS or OET?
I passed. It's a different story actually.
Okay. So stand. Sit. Eye level, yeah. Yo, we admit. Yes, I admit them. Yeah. So stand. Sit. Okay. So clear. So what is the fourth word? Voice. Guys, your voice should not be loud. Your voice should be low, but to the level that he can hear. Because if you are at any point having a loud voice, what's going to happen? It will be intimidating. It will be what? Intimidating. Do you agree? Okay, so how to yeah. So it will be intimidating. Okay? So what is the fifth word? Guys, active listening. I've been for the past 3 years active listening. I have said to him plenty of things, which is my son was about to be given. I know. I looked. It was amoxicillin. I did not give it to him. I know he has allergy to it. And he did not praise me enough. He praised me later. By the way, I was listening carefully. If you watch the video, and you will know what I'm talking about. He praised me later. No. You praise right away. So active listening. What is the difference between listening and active listening? Listening is just listening. What's your name, doctor? Dr. Sitant. He's just listening. But active listening is where what you've listened to. Guys, active listening. While the patient is talking, don't worry. While he's talking, you should not go there, somewhere else to think of what's coming next. No. Trust me. If you reflect on what he's saying, you will finish the station. You understand? So, active listening means you will act on what he's saying. I said plenty of stuff and he did not act on it. Okay, I started writing like when I was saying to him, I did this, no praise. I did this, he didn't praise. I was just somewhere and he's somewhere else. So active listening. So not just listening. So active listening and reflect. If she's saying something good, praise. If she's saying, you see, I am his mom, I can see you are very concerned mother. Look, what happened? You know, like always try to, while she's talking, give her the space. He was doing plenty of nice things. When I was talking, he was nodding, which is good. Nodding means that, yeah, I'm with you. Yes, carry on. You understand? This nodding is good. That means that I'm here with you. I'm listening to you. I'm all ears. Yes, I'm here. He was doing this. He was calm. He had plenty of good things about him. I'm just giving the feedback and that, you know. So this is active listening and reflecting. Please, an angry patient is very important. Imagine if the patient is angry because nobody listened to her while she was talking about allergy, and she's talking to you and you're not listening as well. It's not going to be good, right? Okay, so active listening. What else did I say? What other words? The point. Guys, he never even offered an apology. Apology, yeah, brother. You never even said once, I'm sorry. So he didn't. Go and watch the video. This video will be very educational, So he didn't even once say sorry to a mother who's all over the place. And I showed him so much anger, this fuck you, fucking, But he didn't even I'm sorry. I can see where you're coming from. I totally see now why you are upset. Yes. Guys, when you acknowledge and say, yes, now I can see where you're coming from. Guys, when I said to him, my son wasn't breathing a year back when he asked about what happened. He was not breathing. He was not, at this moment, he should have said, well, now I can see why you are so much not happy like this. Yes, you have the right. Yes, from what you told me, that sounds so distressing. What sounds so distressing? The story that I told them about. Wallahi, I mean, this is PLAB 2. It's just listen and act in a normal way. Like you talking to your friend, for example, and the friend said, you know what happened? Our friend, he did this and this and this to me. Wow, oh my God, that's terrible. When you talking about when you gossiping about somebody else, wow, this is terrible. Oh my God, did he do all of this? Oh my, now I know why you're hating. Oh, now I know why you have that much hatred against him. So as if you are sitting in back home in my country outside the house and you are gossiping. That kind of gossip, So please acknowledge, reflect. So pick any word she says, and if it's good, go for it and praise. If it's bad, say sorry. And you understand? So, and if she said a terrible experience, reflect. Now I can see, guys, they understand me. Now I can see, yes, it sounds so distressing. what you've just told me now about the fact that he was not breathing and it sounds distressing. Wallah al-azim, plenty of marks in the street. You're speaking marks, you know, like, you know. So these cases are communication. How will you communicate? You understand? So what else did you say? That's it. So this all about how to deal with an angry patient, guys. Please practice on these points. Trust me, you're not gonna have a problem with an angry patient. Think about it. Eye level, voice, low, stand, sit. If he's lying down, lie down. Understand? your eye level should be the same eye level. You understand? Same eye level. You get me? And then the tone of voice low is not high. You understand? And always reflect. If she's saying something tough, she's passed through, reflect on it in the way that I can see. If she said something, you know, like, you are just a mirror. You are in a mirror. She's saying something and you need to reflect on it. Anything she's saying, you reflect on it. Anything she's saying, you reflect on it. That's it. It's like just, it's a mirror. You are talking in a mirror and you are basically reflecting on what's happening. Okay, so that's dealing with her. Then once she is sorted, you will move into the patient himself. You will say, so look now how I will slide down. Yeah, it's like a slide. So I will slide from one thing to the other. Yeah, look. So now my main, but look, your heart, the left ventricle, where the oxygenated blood is coming from. You know, you can say to your girlfriend, I love you, and I love you normal. And you can say to her, I love you from your heart. You know, seriously. So talking to the patient, seriously, wallahi, talking to the patient, he or she must feel your worries. He or she must feel that you are caring. You understand? So when you talk, your body should show. Well, look at the way I'm talking now. It's very concerning. You know, look at the way I'm talking now. Well, so it's okay now. I'm worried about Adam. You've mentioned to me that for the past 2 days he hasn't been given antibiotics, so it's already have a chat about him. So we make sure that he's sorted and we make sure that you understand. Look at my, you see this, not well. So it's okay to have a chat about Adam now. You see the difference? Seriously, no, seriously. You see the difference. So we need to make sure that the words, because he feels it, she feels it, and the examiner and the asker, the simulator, what do you think of him? So please show, wallahi, in my Breaking Bad news station, wallahi, if they would have left me 1 minute extra, I was gonna cry. Wallahi, I was gonna cry in the station. That's how much I was, you know, I wanna pass, mama, you know, no problem, you know. So my point is, once you finish with the mother, you need to have a sentence signposting to move to the page. So now my main concern, look at me. Now my main concern is Adam. You've mentioned to me that he's been having antibiotics since yesterday. So it's all right to have a chat about him to make sure that he's all right. Yes, doctor. Then what happened yesterday? Symptoms? Any new symptoms? Because it's 2 days now. Any new symptoms? Okay. So acute meningitis, there is fever, there is rash, anything quickly, and then move on to no examination, because he's been examined by a doctor who just passed the PLAB 2 and they didn't active listen. He scraped through PLAB 2 and no active listening. So now you need to further examine and say to her, well, I know that he's been examined yesterday, but because you presented today, so I want to make sure that he's all right. Again, left ventricle, not the right one, yeah? From the left, I want to make sure that he's okay. So it's all right. Ideally, I'll have a look at him, I'll examine, I'll check his chest, and then we'll move further. First of all, I will what? Do allergy test before I give him any medication, because the problem is allergy. So please mention allergy test before I give him any medication. And I will give him antibiotics and will treat him accordingly. And it's very good, as you mentioned to me, that you mentioned that he's allergic to the doctor. Please keep doing it. It doesn't mean that it was missed the first time or last time. Please keep doing it, you know, encourage her. Can you give him a bracelet? Is there something called allergy bracelet? Is there? Can you put a bracelet allergy? Yes, guys, it's fine. Yes. If it's gonna be kept, they put bracelet. It's fine. Because I told you that he's not been given antibiotic according to the clinical judgment. If we need to keep him in the hospital, we're gonna keep him in the hospital. You understand? So if he needs to be kept, you're gonna say to her, we'll examine him, we'll make sure everything is fine, and if we think that he will need to be kept here, as you mentioned that he was not given, we'll keep him. We'll put a bracelet to make sure that it's not going to be missed. Keep doing it. Keep mentioning this whenever you see a doctor that he's got allergy. Guys, are you lost? I'm giving you a phrases that you can use it and ideas. Yeah. Now I'm giving you ideas that maybe you know about it, or if not, get it now. You know. So, and then if she's still angry, still upset, and anything, if you see that she's still not happy, you can what? Yes, offer. If she wants to complain, she can complain as well. Clear. If I make a small change to the station that he was given amoxicillin and he's coming with rash, okay, first of all, she's angry. Would you approach it the same way? Yes. But because he was given the medication and he's coming with rash, you will exclude that this rash is not meningitis. Clear. By asking any other symptoms, shadow from light, neck stiffness, no doctor. And when did the rash appear? After the medication or before? After doctor. So now you know it is a rash of medication. So in this case, you will add on management the histamine. Right or not? You get me? So you will add in this station medication for the allergy. You can give him medication for the rash. You can, guys, and you don't need to mention names. There is a medication called the calamine lotion. You don't need to mention names. You said we're gonna give him cream to put on his rash. Okay? And the medication for the allergy. And always assess it's not anaphylaxis. Any short of breath, any swollen tongue, mouth, no doctor. So if she mentioned he was given and he developed the rash, you need to exclude that this rash is not what? Anaphylaxis, and is not what? Meningitis. And that's it. If not, you are safe. And move on to management. And in management, you will check the allergy status. You will give him medication after doing the test, but you're gonna add what? For the allergy that he has, you're gonna add what? Anti what? Yes, medication for the allergy, and calamine lotion or lotion, just don't mention anything, for the rash, and again the paperwork. Clear? And always educate. Well done, praise, and educate about telling that the child has allergy. Tell her, well done, you mentioned that, you mentioned keep going, and well done, you know, like things like this.
Can I ask you a question?
Dr. Mo?
So this allergies in the hospital.
Yes.
Are we going to take a review with the allergy?
No. Yes.
Dr. Mo,
Guys,
just
allergy specialist and the referral to allergy no. This is later. This is now. You are dealing with a case now. You know, like no. You understand? He's got allergy. You're gonna check the allergy status. No other allergy. That's it. And give him the medication and sort him out and address her problem. And that's it. Yes.
do we have to offer her to make a complaint, or shall we wait for her to say that she wants to complain?
Guys, we never ever offer the patient to complain unless the patient tells us that he's not happy. So guys, the only time that you say complain, there are two situations when you say complain, when you mention complain. Two situations when you mention the complaint department. Number one, if the patient is still not happy, or if the patient mentioned, I want to make a complaint, or he's still not happy. Number two situation, if you don't like your colleague, then would you like to make a complaint? Would you like to think about it? Or we can tell you everything about it. If you don't like your colleague, then you can tell her. So please, if you see that the patient or the relative is not happy, if you see, guys, it's your judgment. Oh yes, doctor, thank you very much, doctor. And now it's sorted. Thank you very much. You're very caring. Do you want to offer complaint? No, but she's still not happy. Offer.
Dr.
Can you please mute your mic, guys? Next
close your
station.
mic.
I think I've given it enough time, so we need to move on quickly. There is nothing else we can talk about an angry patient, guys.
Dr.
And
Mike,
please,
kindly turn off your mic, please.
one of the main things that you do, that when you simulate with your friends, you don't show anger. So how can I help you? Guys, show anger. Stand up. See your colleague. You know, come close to your colleague. When you practice, show anger. Next. Doctor, please mute your mic. Some people are really annoying. They go to the meeting, seriously. It's really annoying when it's on. They go to the meeting, they leave the mic on, and they're having a chat. If you're gonna have a chat, leave the meeting. Why are you attending? They have a chat and they go somewhere else, and that's it. They leave the meeting. I don't mind, okay, but nobody can hear. I cannot hear anyone. Nobody can hear me, and that's it. Next station. Guys, did we add anything to the angry patient? You know?
Will we fill incident form in this case because the amoxicillin was not given?
Guys, any station where there is harm on the patient, if there is what? Harm or something like about to, yes, 100%. Okay? It's like Datex. Datex in a hospital, Datex is called Datex in a hospital, doesn't mean that there was harm. Datex are type. Mild harm, moderate, no harm, severe harm, it's levels. But yes, you do. Okay? Yes. Yes. Okay? So there are things that I don't like, you know, we're gonna update the documentation and, you know, you tell her, I like to make things natural. You understand? There are things that we always read all the time and everybody will say, well, I would like to tell you that we're gonna update the documentation. You know, it's so, everybody will say, it's not obligatory. As long as you said, but by the way, some people say we're gonna update the documentation. This case is not a documentation case. It is somebody who didn't listen. So try to filter things. Update the documentation if the documentation did not say allergy. But if the documentation said allergy, that will be, you understand? You get me? Yeah. Anyway, guys, next station. Okay, one of the doctors. One of the online doctors.
Captain, can you mute your mic, please?
Okay, Dr. G-A-Y. Can you please open your mic and let's do the station? Doctor, can you open your mic and let's do the station? Dr. G-A-Y, can you open your mic and let's do the station? Okay, he doesn't want to open the mic. Guys, I told you all the time, put your names and things. I can see Dr. G, Dr. D, Dr. Dot, Dr. Chlamydia, Dr. You know. Guys, put your names because I want to know the names. Okay, Dr. Hira. Have an hour to choose someone. So you just like.
Hi, sir. How are you?
Yes, do you want to do a station or not?
Yes, I want.
Perfect. Let's start. Write down the station, guys. Write down. Yes, doctor.
Yes, sir.
Don't worry, if when it's disconnected, I will put a new one. No worries. Okay, next patient, guys. You are an FY2 doctor in the A&E. You are an FY doctor in the colorectal department. Colorectal department.
Okay.
Mr. Mo Sobhy, 75 years old, was brought by the ambulance yesterday because he fainted.
Okay.
Okay. It was found that he has bleeding per rectum, rectal bleeding. All blood tests were done. The patient was transfused the blood. He's now stable. He's now what? Stable. Your consultant, the colorectal consultant, asked you to talk to the patient, about colonoscopy, as colonoscopy is needed urgently. Talk to him, address his concern.
The patient name is Dr. Mo. The patient name is
Mr. Mo Sobhy. Guys, are you benefiting anything?
Okay.
At any time, you're not benefiting anything. Seriously, you have exams, so feel free to leave. I'm not offended or anything, just, you know, so.
Can I start?
Yes, you can.
Hello, my name is Dr. Hera. I'm FY2 doctor here. I'm asked to counsel you regarding colonoscopy. Are you Mr. Mo Sobhy? Can you please confirm me your age?
Okay, I'm Mr. Mo Sobhy, and my date of birth 10th of January 1945. Write down the feedback. Yes,
Mr. Mo, can you please tell me, Mr. Mo, can you please tell me what brings you here today? What happened yesterday? So
you know,
are admitted
yesterday I fainted, doctor, because I lost the blood from my back passage, and I felt dizzy, and I fainted, doctor. Can you make it another meeting? Send Dr. Am is gonna send you another meeting. Can you send it to the group?
Is this first time you have this, or you have these symptoms before? You have this before?
Well, doctor, it is the first time, doctor. I've never had bleeding from my back passage before.
Okay. Can you please tell me more about your bowel habits? Are your bowel habits okay or not?
Well, my bowel habit is fine, doctor. Apart from sometimes I have constipation, sometimes I have diarrhea. But apart from this, everything is fine.
Okay. Can you please tell me that do you have any before you have any kind vomit? Did you vomit out and you have blood in vomit?
No, doctor.
Okay. Did you smoke?
Did I smoke? I don't smoke, doctor.
Do you have any other medical conditions?
Well, doctor, no. I'm totally fit and well, apart from diabetes and the high blood pressure and the previous stroke and MI before.
Okay. Do you have previous history of a smoke? When did you have that MI?
MI I had 2 years back.
2 years back. After that, did you have any hospitalization?
No previous hospitalization, doctor, no.
Okay. Since when you have this hypertension?
Well, doctor, I had hypertension like 5 years back, and it's been managed, and everything is fine, doctor. Everything is stable, doctor.
Can you please tell me what medications are you taking now?
Well, doctor, I'm taking blood thinners, I'm taking warfarin, and I'm taking aspirin.
Okay. Can you please tell me about your diet?
Well, I eat healthy, doctor. Fruit and veg, plenty of fluids.
Okay. please tell me what is your main concern about your condition? Like what
No
you think
concerns,
that,
doctor. I mean, I've been asked that you come to talk to me.
okay. Mr. Mo, actually what we are suspecting that there are 2 or 3 conditions that like you have an MI and you have recent bleeding and also you are on blood thinners. So we need to diagnose that what you are actually having. So for blood thinners, we will send some tests to know that either you're taking proper blood thinners or not to check your INR. And then we are planning you for colonoscopy. So I'm here today to counsel you regarding the colonoscopy. Are you comfortable?
How many minutes, Dr. Amar Sobhy? How many minutes now?
We are 4 minutes 40.
4 minutes 40.
Okay.
Yes, doctor, you are here to talk
Can you
about
please
what?
tell
Sorry.
me? I'm here to talk to you about a procedure which we will do to know that why you are having this bleeding from your back passage.
Okay. What procedure, doctor?
Okay, this is a procedure in which we introduce a camera like tube, so we can check that exactly what you are having. Are you comfortable with it?
With what, doctor? With the procedure?
Yes.
No, doctor. I don't know what about this procedure, doctor. What is this procedure, doctor?
Actually, it is a procedure to check your bowel to investigate the cause of the bleeding. So what we will do a tube with a camera to check why you are having this bleeding.
2 minutes remaining.
Are you comfortable with it? Are you comfortable with it? Mr. Mo, are you not comfortable with the procedure? Mr. Mo, you are not comfortable with the procedure? Mr. Mo, you are not comfortable with the procedure. I just want to ask about the procedure. Hello?
I think he is not here. He's muting himself.
Is there any issue with the video or the chat?
He has a chair says that you're saying some technical difficulties.
Hello?
So bear with him.
Tomorrow there's no voice.
Hello?
If you can hear me, there's no voice.
Okay. Sir, can I?
I think they've muted it on purpose. I think so. No.
No, it is not. My mic is not muted. I was
No,
asking
they
that.
haven't muted. It's no, Dr. Mo's mic. Dr. Mo's mic. I think he's muted it on purpose, along with the video.
Okay.
I'm not sure though.
Okay.
I think his finger touched on it somehow, but maybe not.
I don't know.
Yeah, he has submitted a message in the chat box that he is trying to figure out the problem, so don't worry.
Okay, okay. I thought I'm too bad that you don't want to listen me.
Don't think about it too much.
Dr. Mo, the sound still is muted.
Guys, he's done it on purpose, I guess.
No. He's trying to fix the problem.
Okay, doctor.
Maybe it's better if we close the meeting and create new link.
No, don't do this because you are not able to attend it again, to join it again because there is something with connection. Don't do this.